As a man grows older, his prostate gland doesn't stop growing, which can lead to problems with a larger prostate. This is known as a non-cancerous condition called benign prostate enlargement. It's important to understand that this is different from prostate cancer, as they are two distinct health issues that require different treatments. Benign means it's not cancer, but don't be fooled. Even without cancer, an enlarged prostate can bring about discomfort and complications. The most widespread issue that affects men after the age of 50 is a friendly-sounding benign enlarged prostate. Unfortunately, it's not always as friendly as it sounds. This condition can bring along some bothersome bladder problems, like needing to pee often, sometimes losing control of your bladder unexpectedly, having a weak urine stream, and feeling some discomfort when you go or after you've finished. If your symptoms aren't causing you too much trouble, your doctor might suggest keeping an eye on things with regular checkups before jumping into any treatment. But if it's time to take action, there are two kinds of prescription medications in the toolbox. One group called alpha blockers, which help out by relaxing the muscles in your prostate and bladder, and the other gang, 5-alpha reductase inhibitors, which work by stopping the hormone that encourages your prostate to grow bigger. So in today's video, we will look at the 8 natural ways to treat an enlarged prostate. Note that this video is for educational purposes only and does not aim to replace your doctors. Today, NSAIDs, non-steroidal anti-inflammatory drugs, represent a class of pharmaceutical compounds renowned for their potent anti-inflammatory properties. Within this category, prevalent examples include aspirin. These medications are frequently prescribed to mitigate inflammation, primarily in the context of arthritis symptom management and as a prophylactic measure against heart disease. Moreover, emerging research endeavors to shed light on the potential benefits of regular NSAIDs consumption, particularly among men, with promising implications for prostate health. It is important to note that while preliminary findings are encouraging, additional scientific investigations are requisite before recommending the routine use of NSAIDs for the specific purpose of ameliorating an enlarged prostate. NSAIDs exert their anti-inflammatory effects by inhibiting the activity of enzymes known as cyclooxygenases, specifically COX-1 and COX-2. These enzymes play a pivotal role in the synthesis of prostaglandins, which are bioactive molecules responsible for propagating inflammation in the body. By blocking COX enzymes, NSAIDs reduce the production of prostaglandins, thereby diminishing the inflammatory response. 2. Saw palmetto. Saw palmetto is a natural dietary supplement derived from the fruit extracts of the saw palmetto plant. It ranks among the well-received herbal remedies employed to address urinary issues, particularly those associated with an enlarged prostate. This herbal remedy is available in multiple forms, such as encapsulated pills or as a liquid extract. The efficacy of saw palmetto in supporting prostate health is attributed to its rich phytochemical composition. Saw palmetto berries contain a variety of bioactive compounds, most notably fatty acids and plant sterols. One of the primary mechanisms by which saw palmetto is believed to influence prostate health is through the inhibition of 5-alpha reductase, an enzyme responsible for converting testosterone into dihydrotestosterone. DHT is implicated in the growth of prostate tissue and the development of benign prostatic hyperplasia, a condition characterized by an enlarged prostate. Scientific studies and clinical trials have explored the potential benefits of saw palmetto in mitigating the symptoms of an enlarged prostate. Some research suggests that saw palmetto may help reduce the size of the prostate gland, alleviate urinary symptoms. It is thought to exert its effects by interfering with hormonal processes and exerting anti-inflammatory and anti-androgenic properties within the prostate tissue. A range of 100 to 960 mg daily has been used to treat enlarged prostate, but according to the National Institutes of Health, a few studies have shown it to be effective. As a result, saw Palmetto is one of the most commonly recommended natural remedies. 3. PGM. PGM is a natural supplement derived from the bark of the African plum tree. This extract has a long-standing history of use in addressing enlarged prostate. It operates as an anti-inflammatory agent and may yield positive effects on bladder function as well. A small-scale investigation has suggested that when paired with other herbal remedies, PGM could potentially alleviate issues related to frequent urination in individuals with an enlarged prostate. However, it is vital to stress that additional clinical trials within the United States are required to conclusively establish its effectiveness. 4. Ryegrass pollen. Grass pollen is a natural extract derived from the pollen of ryegrass and timothy. This supplement is believed to offer relief by diminishing the need to visit the bathroom during nighttime hours. A particular study has suggested that ryegrass pollen may hold promise in alleviating symptoms such as frequent urination and nocturnal trips to the restroom. The potential benefits of ryegrass pollen in addressing urinary issues, especially in the context of an enlarged prostate, are connected to its ability to influence certain receptors in the lower urinary tract. These receptors, known as alpha-adrenergic receptors, are involved in regulating muscle tone in the prostate and bladder. When these receptors are overactive, they can lead to increased urinary urgency and frequency. Ryegrass pollen is thought to help normalize the function of these receptors, leading to reduced urinary symptoms and a decreased urge to urinate, especially during the night. This normalization of receptor activity can contribute to better bladder control and a potentially more comfortable night's sleep. 5. South African stargrass. The South African stargrass, renowned for its extracts rich in beta-sitosterols, is harnessed for medicinal purposes. Beta-sitosterols, which are plant sterols, are believed to have anti-inflammatory properties and can potentially enhance urine flow in men grappling with an enlarged prostate. Interestingly, beta-sitosterol is also present in select food items like yogurts and margarines. Scientific evidence indicates that beta-sitosterol may indeed offer effectiveness in addressing urinary symptoms associated with an enlarged prostate. The beneficial impact of South African stargrass lies in its beta-sitosterol content. Beta-sitosterols are plant compounds akin to cholesterol and have been shown to possess anti-inflammatory attributes. Beta-sitosterols, by mitigating this inflammation, may aid in reducing the size of the prostate gland and improving urinary symptoms. Moreover, beta-sitosterols are thought to interact with receptors in the lower urinary tract, potentially leading to enhanced urine flow and decreased urinary urgency. By modulating these receptors, South African stargrass extracts may provide relief for men dealing with BPH-related symptoms. 6. Red clover. Red clover, a plant distinguished by its vibrant flower tops, serves as the source for herbal supplements employed in the management of various health conditions, among them an enlarged prostate. These supplements have shown potential in diminishing the frequency of nighttime bathroom visits for men grappling with an enlarged prostate. However, it's important to acknowledge that there's a need for further scientific evidence to conclusively establish their effectiveness in this regard. The potential benefits of red clover in addressing the symptoms of an enlarged prostate are linked to its phytoestrogen content. Phytoestrogens are plant compounds akin to the hormone estrogen. Red clover's phytoestrogens may help to regulate these hormonal fluctuations, subsequently reducing the size of the prostate gland. 7. Stinging nettle. Stinging nettle, a plant steeped in a long history of medicinal use across Europe, derives its name from the fine hairs on its leaves that deliver a sharp sting when they come into contact with human skin. These leaves and the plant's root are believed to harbor medicinal properties. In the European tradition, the root is frequently harnessed for addressing an enlarged prostate, a condition known as benign prostatic hyperplasia. It is hypothesized that stinging nettle may enhance urinary flow in men affected by an enlarged prostate. Stinging nettle's potential role in managing an enlarged prostate revolves around its various bioactive compounds, including flavonoids, sterols, and lignans. 8. Pumpkin seed oil. Pumpkin seed oil, available in convenient capsule form, has shown promise as a safe and potentially effective alternative for treating an enlarged prostate, scientifically referred to as benign prostatic hyperplasia. In one significant study, researchers administered a daily dose of 320 mg of pumpkin seed oil over the course of 12 months. The results of this study indicated that pumpkin seed oil outperformed a placebo in enhancing both symptom relief and overall quality of life for individuals with BPH. One prominent mechanism of action revolves around its anti-inflammatory properties. Inflammation is frequently associated with prostate enlargement, and pumpkin seed oil's anti-inflammatory effects may help reduce the size of the prostate gland. Additionally, the oil may interfere with the production of hormones like dihydrotestosterone, which are implicated in prostate tissue growth. This modulation of hormonal processes may contribute to symptom improvement and a better quality of life for those with BPH.